Welcome back. Back with us today is Dr. Regan Tilley, functional family physician. Welcome back, Dr. Tilley.
Hi, Jessica. So glad to be back with you.
I'm so glad you're here. We talk a lot about the work that you're doing where you look at the whole person in functional medicine for the root cause, and you do a lot of work with people who have experienced trauma.
Yes.
So we had spoken off camera a little bit about how that can impact relationships or end up having you stuck in relationship. And I'd love to have you speak with our audience about what you've spoken with me about.
Of course. I find that oftentimes a lot of our pathology has to do with the relationships we're in. And it's either past relationships or current relationships. So one of the questions that I do ask over time as I get to know my patients or the members in my program is, how do you feel your support system is? Do you have a good relationship? Do you feel like you have a friend group that's strong? Do you have a supportive spouse or partner? And you can usually tell when somebody's like, it's fine, it's okay. And that tells me this is where we need to do some work. And what I have found through the years is that when we are creating relationship with other people, when we are meeting our partner or spouse, or we're trying to find our friend group, a lot of it has to do with the way we feel about ourselves and also about how we were perceived when we were children. So one of the things that I find extremely revealing is this the first time you've been in a relationship like this? Or do you have a pattern? Like, do you keep having the same thing happen time after time? And it doesn't always have to be like a romantic relationship. You can be in a job that it seems like I have this pattern. I go in, I work really hard, I really get along with my coworkers, then it seems like everybody turns on me. Or, it's the boyfriend cycling or the girlfriend cycling where, it's really great at first and then there's always something wrong with them. Like, they won't tell me they love me, or they say I love you right from the beginning and I just can't, right? So there's these toxic cycles that we go through. And when we look at why do we continue to do that, it comes back to, what are we trying to heal? What piece are we trying to fill? What are we missing? And sometimes we only have had bad examples. We've seen abusive parents or alcoholic parents, and it's one of those situations where it's not a very great education on what to look for in a partner, right? So we just do the best we can. But sometimes we just find that, this one particular guy, he was great and then he wasn't, and it could either be an abusive relationship or it could just be like a neglectful relationship, or just they ghosted you, they checked out and you were still seeking. So again, I love to do research and I love to read and find different ways to understand. And one of the ways that I found extremely interesting was through a book called Existential Kink by Carolyn Elliott, PhD. And it's got a very seductive title because kink is just a little something different. And what she does is she kind of walks you in the shadow work, like what we don't bring to light.
Explain shadow work so that people.
So shadow work is something that has to do with dealing with the parts of us that we don't want other people to know about, essentially. That's the easiest way to describe it. It's the things that are parts of us that we don't let out in the light very often. They're not all bad. In some people, a lot of people think shadow, that's dark and bad. Honestly, those are the things that have kept us alive. Those are the parts of us that help us survive every trauma, every hard day, even some of those things that we need to survive from. Like if there was a catastrophe that we needed to be secure, that shadow side of us is going to be our victor. Okay, so there's nothing wrong with our shadow, but sometimes we need to nurture it and let it have its space while we can bring our productive, conscious self to the light. And so that's what shadow work is.
Thank you for elucidating
that. So reading that book, the examples given are really profound to me. And it was one of those things that when you start to investigate why you keep doing the things you do that you don't feel good doing. And I can equate this to weight. I can equate this to the job. You keep going back to the abusive boss, or you keep going back to even in families. Sometimes there's that toxic family member that you're like, I just have to go suffer through. And then my question is why, right?
Yeah.
Why do we keep doing it? And so what she elucidates, some of that is that we get off on it a little bit. Because when we keep going back to this bad boyfriend, right? our friends are like, oh, you poor thing, he's so awful to you. Can we take you out and give you a good time tonight? Or, oh, it's just not right. You know, you deserve so much better. Listen to those words. You deserve so much better than you're getting. And there's a piece of us that wants that. We want to be told that we deserve more. So we keep taking just a little less than we deserve because we're going to get other people to recognize that we deserve more, right?
Okay.
And so this is that existential kink. This is I keep going back to just a little subpar so that other people recognize that I'm worth more, right? It's just this little tiny thing that makes you feel good inside. It gets that little tiny tail wiggle of like, ooh, they think I'm special.
Okay. I want to dig into this a little bit.
Yes.
So because in my head I'm going, that would be hard for me to have people say you deserve more when I'm in something that I am loving.
Sure.
But is it something then that somebody, because if I'm in that spot or anyone's in that spot, it is, then is it that you're really looking for, you really would rather have people say you deserve more than actually have more?
Well, this is where it becomes a pathology, right? Or this is where you're stuck in a maladaptive situation. So what I'm speaking to is not a relationship that you feel great in. Like if you are in a relationship,
that isn't feeling
yes,
great.
that you're constantly like, why do I go back to the bad boy? Or why do I go back to the guy who cheats on me? Why do I go back to the alcoholic? Why?
Yeah.
So part of that can be, what did you see growing up?
Okay.
You know, maybe your mom or your dad cheated on the other.
Yeah.
Or you had an alcoholic parent, or what have you. That's normal to you. So you think that's the kind of relationship you should have subconsciously, when maybe the forebrain or that conscious self says, no, you want a strong masculine partner when you're a woman, or you know, whatever you're seeking, whatever your partner of choice is.
Yeah.
You have your ideal, but then we start to settle for less. Sometimes. Not all the time. Some of us are gifted with the most wonderful relationship that's super supportive. They see you for who you are. They're your best cheerleader and they love you unconditionally. Those are often sabotaged as well because something inside tells you you don't deserve it.
Yes.
Yes. And so this is where this existential kink book comes in.
Okay.
There's a wonderful workbook that you can go through with it. There's some meditations. The author comes at it from her paradigm, which I love. Not everybody's going to resonate with it, and this is where we have this phrase of take what resonates and leave the rest.
Behind, yeah.
And so, but there's so much, and it's actually really good work. And what I have found in my programs is that what we need to do is face the stuff we don't want to, the stuff that feels hard, the stuff that you're like, ew, that's wrong.
Yes.
Absolutely not. I don't believe that this can actually be true. I'm like, let's examine that. Why not? And so this is where I kind of ask people to stretch, and we're going to push into some of the uncomfortable. This isn't going and reliving trauma. What this is let's explore that feeling. Let's explore this emotion that you have with this. And how does it feel in your body?
Yeah.
How do you feel when you put yourself on this side versus that side? And why do you think that your body needs to be here versus there?
So it was the question, and I was in a marriage too long. Once again, as you had said in a previous episode, I have nothing bad to say about my ex-husband. It was just in a marriage for too long. And I did a lot of this work, and that is how I ended up finding my way out, because it wasn't what served either of us in that space. And we'll just leave it at that. So I can see that, getting in that space and being stuck. So what we're looking at is really when you're stuck in something and you're not sure if we just kind of become imprisoned by that space, or
and that's where we numb out. Right.
And just become, this is my day to day, and that can impact our health.
100%. And I truly believe when we start looking at that is women have far more autoimmune disease than men.
Okay.
And what I think that is that we suppress our desires, opinions, and needs in order to nurture the other people in our life. Children, spouse, parents, in-laws, friends, all of that. I don't want it to be a stereotype per se, but in general, when we look, women tend to be nurturers. And
it's natural.
Yes, it's
a natural
who we
space
are.
to nurture.
Yes. When we are trying too hard to do both,
To do
be
both
masculine and feminine, right? So we want to be nurturing, but we also need to be powerful.
Right.
And when we try to push into that power a little bit, we get a lot of pushback. And when we aren't able to or can't articulate it or choose to suppress some of those things, that's where pathology and illness comes from. I'm 100% certain my previous job and previous life, I suffered from lupus. And I had incapacitating pain on a daily basis. It would wake me up from my sleep. And when I went through the spiritual healing, when I went through some meditation, when I went through some examination of these emotional things that I was suppressing and not allowing myself to express, when I did that work, my pain disappeared. It wasn't a drug that did it.
Yeah.
It wasn't a physical therapist that didn't. It wasn't even a mental health specialist that did it. It was my spiritual work. So I dug really deep into who I am and what I need to express fully in my relationship. The thing is when you do that, sometimes those relationships dissolve because you're no longer their idea of what you should be. And sometimes, you know, I was in that relationship from the time I was 17 on, so I was still very immature. And when I realized at 42, I was still feeling like that 17-year-old inside and not being recognized as a powerful woman who is a mother and a physician and running the house. That was a big deal to me, to recognize that. And again, this isn't to speak negatively of my ex-husband at all. We just were not in the same space any longer. And I couldn't be who he needed, and he wasn't who I needed anymore.
And I know it can be scary when we look at, are we going to remove ourselves from this, or are we going to do this work on ourselves, knowing full well that it might alter or shift the relationship that we're in, and that can be a challenge. Thank you so much for being with us again today, Dr. Tilley. Join us again next week.
We'll be here.
Please let everyone know how they can find you.
www.wholehealthmhk.com.
Thank you so much. That's easy. That's wonderful. And I know you have a quantum metabolic reset program at quantummetabolicreset.com as well for people to help lose weight and address some of these issues for themselves too.
Body, mind, and spirit weight.
That's
all
wonderful.
of it.
That's great. Well, thank you so much. I'll see you next week. And thank you for watching. Come back after these messages for our next guest.